now I'll go to the stem track. And this is also helpful in prostate cancer because it can assess the aggressiveness and the risk of metastasis. Cancer stem cells and circulating cancer stem cells are a subpopulation of tumor cells with stem cell characteristics, which include self-renewal capacity and also the ability to develop into a heterogeneous population of cancer cells. They are most probably responsible for tumor initiation and recurrence and metastasis. They are unfortunately resistant to most conventional chemo and radiation therapies, and that's why current treatments often are ineffective. Therefore, strategies to eradicate the cancer stem cells are in the focus of cancer research. How we proceed, again, we only lyse the red blood cells. We take the white blood cell sediment, and then we culture the cells of this sediment all together, white blood cells and tumor cells, for 3 weeks. And only those cells that have the capacity to multiply under the current conditions, which are especially designed to have epithelial cells grow, they grow into these spheres, which are not adherent to the underground, and which we can determine not only whether they are present or absent, but also the quantity of the circulating cancer stem cells. We can also characterize them, and in prostate cancer, especially CD44 positivity and CD133 positivity. These spheres, these multiplied cells, express typical markers of tumor stem cells. This can be determined under the microscope. We have published this in 2016, and it's appropriate for assessment of the risk of metastasis, the monitoring of therapy progress, and early detection of a possible relapse. Again, this is the same patient as I showed already before, and also the cancer stem cells decreased under bicalutamide therapy, but after stopping, there was an increase also of the stem cells. And this was consistent with newly diagnosed liver metastasis. This is the same patient as I showed in report 2. And here you can see that the cancer stem cells drop to a low level, consistent with a good treatment response and clinical remission. And this is another patient. And here you can see that also under complementary therapy, there was a strong variation in cancer stem cells numbers. It dropped to a low level, but showed repeatedly a tendency to increase. And at the last examination, we found a very high number of circulating tumor stem cells, suggestive of metastatic disease. And indeed, 3 months later, the bone metastases were diagnosed. So this is an early marker of development of metastases. So do you have any questions with regard to these results?
Yes, there are questions from before open. There's one question: can you test PSA from the same blood vial as the CTCs?
We do not do PSA in serum. We just test PSA on the tumor cells. And this is because PSA is a questionable marker. It should not be tested during therapy. That's not our opinion. That's common opinion, because if the cells die, they will release PSA, and then there can be an PSA flare, and this suggests there is an increase in tumor cells, but it's not. In contrast, it's the sign that the cells are dying. If the PSA increases in an untreated patient, this means that there may be tumor present with dying tumor cells. Then it's a sign of growth of, for example, metastasis. But during therapy, it's a questionable marker.
Can you please point out if there's only one blood tube needed for testing the PSMA and the PSA on CTCs, or are there more blood tubes needed?
Well, if it's a 7.5 ml blood tube, this can be sufficient. We always request a second one in case there is something wrong with the first tube. So if it's very difficult to get blood, it's sufficient with one tube, but we would prefer to have 2 tubes drawn.
But it all can be tested from this tube, so the circulating tumor cells, the tumor cell characteristic, and the cancer stem cells.
Yes, it is possible.
All right. Do you have to request PSMA testing separate?
Yes, we just test whatever you request us. And if you only want to have PSMA analyzed, you can just have it separately given on our request forms. You can always contact us at mail@laborpachmann.de and can ask any questions which might pop up now after this presentation.
All right. Okay, so thank you, everyone. Thank you, Professor Dr. Pachmann, for the presentation. And as mentioned, if you have any further questions or inquiries, please refer to mail@laborpachmann.de.